It's a liver patty.
Not pretty. It's got the gallbladder, common bile duct there.
That's funny.
So liver, gallbladder. Now there's a common hepatic, which is this one, and a common bile, which is that one. Pancreas here. The huh?
Out of curiosity, I wonder why we have different.
I don't know. This is an older version of this is the green version of this has a couple extra terms on here.
Oh.
The yellow.
I got the green one. Yeah.
I don't know. This is older. They thought that older people should know more, I guess. Okay, so we've got. So cystic is the one. So cystic, common hepatic, common bile. Pancreatic duct, and then accessory pancreatic duct. So the pancreatic does this, and the accessory is just this little piece. Common bile duct and the pancreatic duct come together to form the ampulla right there. Then they've got the papillae listed in my book, but not on yours.
Yeah.
Okay.
So you can't test it.
Okay, so there's also
27. 41 next.
Yep.
well the thing that they left out of here, totally left out of this, is the parts of the liver, which I guess I can't ask you the parts of the liver, but the liver does have parts. It's got all those lobes on there. So it's got the right lobe and the left lobe and the caudate lobe and the quadrate lobe. Not in your lab books, so I guess I won't ask those. I should.
That's great.
Give us a pop quiz.
Yeah.
It is basic anatomy after all. I
Yes.
should.
It's in your textbook. I don't know. what's
No,
on
you
there.
shouldn't.
All right. Skipping
The
ahead. Yeah, my page numbers start to get messed up too. So nothing on any of the physiology pages. You can read those if you want. You paid for the book. Okay, so now back to this guy here. He's not sliced evenly. So when they sliced through his head, they left more stuff on this side than that side. So on this side, you've got now this is the nasal bone up here. And this is the nasal septum in here. So remember, the nasal bone is out here. The nasal septum is here. The nasal septum has the ethmoid and the vomer there, and it's got some nasal cartilage there. Septal cartilage. Then we've got, on the other side, superior, middle, inferior conchi. So we've got those conchi. Did that. And don't worry about the foramen of the nasolacrimal canal. It's up here somewhere. Don't worry about the foramen of the nasolacrimal canal. Don't worry about it.
On number 12, skip.
Okay.
Yeah.
All right.
Number 12, don't.
Just you can skip 10 and 12.
Yeah, I was
The
gonna say
septal
we
cartilage is there. Okay, so now it's going to 3C. We got hard palate, uvula, soft palate, palatine process, and palatine bones. Palatine. These are the. Oh, here we go. The maxilla and the palatines. You can see there's a suture there. The tip is the palatine process. If you don't believe me, you can look at this and see the palatine process. There's two palatine bones. There's two maxilla. It's paired. So that's why it says bones. Okay.
I think we're done.
No.
Not even close.
Did the nasopharynx. Lingual tonsils are that little pink spot in the back of the throat. Oropharynx, tracheal cartilages. So now we want to
Basically 1 through 10.
tracheal cartilages here. Whole thing's the larynx. And now, see, this is respiratory, and they're throwing in esophagus, eustachian tube opening. Okay. It's where the ear comes in. So there's the ear. See? That must be the eustachian tube opening because it's in the ear, right through. So you got a hole in your head. Used to be a gill opening. Isn't that exciting?
Really?
Yes.
My mom said my brother had one. I didn't know I did too.
Eustachian tube, hyoid bone, to the tonsils. Okay, so the larynx is this thing, true vocal cords. White line on here is the true vocal cords. The false vocal cords are the little thing above them there. So true, false. All the different cartilages on here, we're missing them. There's got to be another one of these that's got all the cartilages. Well, those are the paired cartilages. The ones that are missing, I'll find one of these. No. There it is. Cartilage. Use your textbook. Know the names of these. Retinoid, cricoid. And skipping down to number 7.
She had one B. Okay, we're not
See,
doing.
it looks like a tree. So we got the bronchial tree. So we got the trachea, primary bronchus, secondary bronchus, tertiary bronchus. Those are there. Bronchioles, where the bronchus disappears into this sac of alveoli, that's the bronchiole. The last bit of it is a terminal bronchus. So over here, you can see it a little better. So this is the bronchiole comes down, and then as it disappears into here, inside of this sac, it's called an alveolar duct. Just outside of it, it's called the terminal bronchus. Just to confuse the students. So down inside, it's an alveolar duct, and so this hole is an alveolar duct. This is an alveolar sac.
These little white things are the sacs.
Each one is an alveolus. So this is an alveolus.
Okay.
So if we go over to B, over there it says alveolar sac, so that's alveolar sac. So we don't have respiratory bronchioles. Don't worry about them. There's nothing to point out. So terminal bronchiole.
Oh, so 2, we're skipping.
No respiratory bronchiole. Alveolus is one of these. Alveolar sac is a group of these. Pulmonary artery. Arteries are blue. Veins are red. Visceral pleura is towards the lung. Parietal pleura is away from the lung. These colors go back to systemic circulation. So this is systemic circulation. This is pulmonary circulation.
It's opposite.
Yeah, it's just to confuse you, specifically for that.
Arteries blue, veins red.
Up here.
Yeah.
Here arteries are red and veins are blue.
Veins are blue.
But I'm not going to ask you. Put this out here. And then diaphragm. Diaphragm, all these, any one of these want to explain diaphragm. Skipping.
G.
Huh?
Oh yeah, we already did all that.
Pleura, yeah.
Yeah.
We're skipping physiology, We're going to urinary system anatomy, starting with this. You got your kidneys, your ureters, your urethra, and so that goes in there like that. Urethra. So you got your bladder here. So the male bladder,